Children in America today are facing social, economic, and systems-level complexities that really require thoughtful, multidisciplinary solutions. And that's what we're all about at Policy Lab.
There are a lot of families under a lot of pressure and a lot of stress these days, and there's a lot of experience of trauma in these families.
One of the threats to children that's been a threat to children since I've been doing policy work is that they're just not seen. How do you get attention for them?
The work begins and ends with the families that we care for here at the Children's Hospital of Philadelphia.
When you think about the things that impact children and the solutions to improve children's health, that's where they come in. You know, they're squarely in the corner of children in everything that they do.
We're not doing research to just publish it in a journal, but to think about how can we improve the lives of those in the community.
How do we not just impact one child and one family, but how do we think about our whole community, our whole country?
We learn from our patients and our families. What are the questions that they're feeling on the front lines? I call it peeling back the onion, and that really is where this all starts. A lot of people will say that you begin to ask important research questions by asking the question, what is the research question? And then you develop a research question and you investigate it, and then you finish your study and you publish it, and then you try to get it into the hands of the policymaker. Our theory of change here at Policy Lab is a little bit different, where we realize you can't ask an important research question unless you've really asked yourself who the audience is you're trying to cultivate, and how's that question defined in their lens.
Policy Lab has gone out of its way to go out to stakeholders outside of the research world and say to them, what questions are important to you?
It's starting from that model that engages our stakeholders up front.
The impact of lead is more handled by older children, but we have to get...
What we really recognize here is that children's health is not only dynamic, but it's really complex.
We are one of the only research centers that actually has a dedicated interdisciplinary team.
Many of the individuals who come to work here at Policy Lab have the opportunity to work in different worlds, and they're able to then bring the lessons that they've learned to us to think through what is it that we're trying to do? Who do we need to get these messages to? And how do we need to really craft those messages to be maximally effective?
They take outputs of research and help us to understand where we need to impact lawmakers or policymakers to really move the dial.
Having a reliable estimate of the number of runaway and homeless youth is critical.
So I was introduced to Policy Lab when I was the commissioner at the Department of Health and Human Services. Policy Lab is working to close the gap between what we know and what we do.
This is a policy-oriented research project. It was intended to inform federal, state, and local policy.
They recognize that there's a complicated world here, and they do studies and produce products that inform the real world. And I think that can go a long way in improving outcomes for vulnerable families.
So you'll find everything here now, from traditional public health epidemiologic research that's really identifying emerging trends in children's health issues, all the way to piloting innovative interventions in our communities and our healthcare system.
One of the projects that Policy Lab has been working on is the overuse of antipsychotics among children, and in particular children in the child welfare system. One of the reasons that providers were relying on strong medications for young children with behavioral problems is that there's not a lot of evidence-based, accessible, good programs to help support children with behavioral problems and their parents. And so Dr. Rubin worked to bring a new parenting program to the city of Philadelphia, specifically for delivery and primary care. PriCare is a positive parenting program, so it's designed to help strengthen relationships between caregivers, as well as to help provide the parents with the tools that they can use to help improve the kids' behaviors at home.
I have my 3 grandchildren, ages 3, 4, and 5. The doctor suggested this program, this parenting class to me. You know, I need help, all the help I can get, because...
What we found was that parents or caregivers who were randomized to PryCare had a lot of positive outcomes. So we saw decreased behavior problems in the kids. We also saw improved empathy towards the children among the parents. And then we're going to use that information to make it even better.
One of the ways that Policy Lab has been successful is that we've been invited to City Hall, and we've been invited to Harrisburg, and we've been invited to DC to share our findings. So we made it in the room.
And what has resulted is this arc from characterizing the problem to developing new programs that, to me, tells the story of what all our investigators are doing here at Policy Lab.
We've grown. We have a fabulous team of investigators, of communication support, of policy support, and we are really conducting research that is on the cutting edge of emerging children's health issues, both locally and nationally.